Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
People always ask me, what do you talk about on your shows? How can you talk for so long? I said, let me tell you, I have the best guests. They're articulate, they're funny, they're smart, and it just works. So I'm always amazed myself how all these great people can just articulate everything that they do. So today, we're going to talk to Lcurtis, and her title is Director of Business Development at Regents Park of Boca Raton. Tell me what Director of Business Development really does, Leslie. We've talked for a long time, but I don't know if they've ever questioned you.
Well, I think, different organizations and businesses, it means different things. I think for me, it means whatever needs to happen. I mean, it's kind of in marketing. I work very closely with admissions, some program development. It's just whatever needs to happen.
Yeah, see, I'm glad you said that because there are a lot of people who are in this and they're just out in the community trying to bring business in.
Right.
But you're there taking care of the business that's coming.
Right.
See. That's how I see it.
Right. I mean, certainly I go out here and there, like I'll go to the BOOMER Expo. There's certain things that I do every year or twice a year because they're my favorites. I wouldn't let somebody else take that over.
Right, and we wouldn't want anyone else there. And excuse me, when talking about that, people know you, too, when they come. They know you, and they stop, and they say, how are you? And
no, they do.
I know.
And so, I do a few of those things myself. I don't give them up. But then, it's the patients that are coming in, making sure that everything's okay. A lot of customer service, dealing with hospital case managers, physicians. There's a lot of things that are involved. Kind of looking at what's going on with the short-term rehab patients that are in-house, medically and from a rehab perspective. And, if you have somebody that's unhappy, you try to understand why and what's going on. So it's kind of multifaceted.
Well, I would think that once you work so hard to let everybody know who you are, you got to make sure that they're happy when they get there.
Right.
And someone who's sick is not always so happy, are they?
No.
They may be a nice person, but...
I mean, and who would be? You're in pain or you're nauseous or whatever's going on with them. They're not, and they've been in the hospital. So it's kind of a...
Right. But actually, when I think of people, I just take somebody, for instance, and we just talk about rehab, and I asked you before we started the show, rehabilitation, we hear what that is, but what really is rehabilitation?
It's a lot of things, and like I say, somebody's coming out of the hospital, they may have some medical things going on, so nursing will be addressing those things. They have to go through their physical therapy, occupational therapy, possibly speech therapy, and, by the end of the day, they're exhausted. And you're right, they're not, it's not that they're in love with the idea of having to go to rehab, but they wouldn't be safe to go home without it. So,
okay, because that's what you actually said to me. You said that when you had a problem, you said you had back surgery,
right?
And if you didn't have, because rehab wasn't. I mean, how long has rehab been around? I know they used to do things in hospitals with pulleys and different things, but you said that you lived on the second floor, and how are you going to get up on that second floor if you went right home from the hospital?
Right. I mean, they discharged me, I think, after 2 days, and I had, 2 flights of stairs to go up. So I had to go into short-term rehab. I think I was only there for 4 days or so. It didn't take me long. Of course, that was quite a few years ago, too. But stop and think about if you're, an elderly person and you have the same surgery. And you have to accommodate stairs.
You probably couldn't walk up the stairs to begin with.
Right.
And now all of a sudden, right?
Right. So it and different surgeries obviously require different safety precautions. But with back surgery, you have to know how you should or shouldn't bend, what you should or shouldn't lift. Those are the things that are real important. So the short-term rehab is really important. And some of these people have really had, my back surgery wasn't bad, but I see some of these people with major spinal surgery.
Reconstruction almost and everything.
And, they're 80 years old, and it's like, oh, my God, there's no way you could go directly home.
Okay.
No way.
So tell me what they do to you in rehab. Do they kind of, what do they do?
Well, obviously there's exercises, strengthening of, upper and lower extremities, safety precautions, depending, again, on what kind of surgery you've had, and working on, like, for me, the stairs was a big deal. I had to be able to get up and down those stairs. Well, it's not as easy. You have to put one foot in front of the other. It's not like we're used to just going up the stairs. Well, after you have a surgery, you have to learn how to do the stairs properly while protecting your surgical areas. So learning how to go up the stairs 1 foot at a time, is you have to learn how to do it. It's not, it's things we don't think about, and again, even, the population I see the most of, do you have any stairs you have to get in and out? No. Well, yeah, they do. They have a stair to get out of the garage into the house. They don't think about curbs that they have to be able to accommodate. Curbs, can be 6 inches. They can be higher. If you have to be able to accommodate a curb, you have to learn how to do it. You don't want to be falling.
We don't think about that.
No.
But when you've had the surgery, you're probably a little nervous extending that foot out, right?
Right. And depending on, again, what kind of surgery you've had, you might go home with a walker. You might go home with a cane. You have to learn how to use these devices. Have you ever used a walker?
No.
You'd have to learn how to do it. It's interesting.
You don't just push it along.
No. Although I've seen people, that I wonder where they were taught how to use their walker, because I see them coming up. My window faces, people coming in, and I'm thinking, oh, my God, they're going to fall, They're
going to fall using their walker.
Yeah, I'm going to go dashing out there. But, yeah, it's something that you have to learn.
Well, can you use a walker going up the stairs?
I think theoretically you can, but I wouldn't want to. I would be terrified.
The one thing I've noticed is that, and helping my husband, of course, who has the macular degeneration, he's very careful because we can't let him fall, is if you don't have a lot of marking on the ground, from the curb to this place or the stairs, they don't see the difference in one step to the other.
No. And it's the same with, I was talking to Dr. Lampert, actually, about using the bathroom, men.
Oh,
and he said,
that's right.
There are things you can do, bright strips or something that they can see so they can better use it.
You're absolutely right.
Safely.
You're absolutely right. Because
so
they don't see it.
Right. They just don't.
Well, because if you just look, it all looks like one big, long thing.
So it's amazing all the different kinds of things that we deal with, whether it's visual, whether it's physical, and medical. Patients that may be newly diagnosed with diabetes, they have to learn how to administer their insulin, how to check their blood sugars.
No, that must be very difficult.
Yeah. So, new ostomies, whether it's a colostomy, ileostomy, they have to learn how to take care of those things.
And that's really what it is, isn't it?
Yeah. So it's not just, hips and knees that we deal with. Somebody that's had a stroke.
Yeah, we think about that, but with a stroke, that must be horrendous to try to figure out how to even get up out of your wheelchair.
Right. So, and again, depending on the severity of any of these things, but you need to bring psychiatry and usually psychology. It's a big change in someone's life, especially if it's, affected speech or swallow. So there's a lot of people involved in the rehab team. Nursing is very important because, They're keeping an eye on the patient's lab results, blood pressure, all those things that nursing does to make sure that they're remaining medically stable. And, you've been in the hospital, you've had a major event, things go wrong. So nursing's always there to monitor those things.
Well, Lcurtis, you have made this very, very clear. I must say, I've been around this a lot, but I've never had it so specific because even though my husband has had lots of therapy from time to time, talking with you now about some of this really makes a lot of sense. And so let me just give some information. Lcurtis, again, we told you she's Director of Business Development, Regents Park at Boca Raton. If you would like to go to their website, and their website is so comprehensive, you'll see everything about it. It's a beautiful, beautiful community. I hate to always say facility. I don't like to call it a facility. It's really a community of a lot of people, right? You get to live there, actually, short term, or you get to live there long term. It's up to you, but it's called regentsparkboca.com, regentsparkboca.com. And the phone number to call, just get your pencils out. We always say this is Pencil Talk Radio, is 561-483-9282. 561-483-9282. And something that you do, and I know that you have like open houses there. You have things that people can come and just look before they have to go and have this surgery so that they can talk to people, just like what you've been telling us on the radio.
Well, and, I can't even stress strongly enough that if you know you're going to have a surgery, go look at facilities and choose where you want to go, especially with season coming upon us. It's harder to get a bed in short-term rehab because the snowbirds are down. So, if I know somebody's coming in, I know they're going to be in the hospital for probably 3 days, and we can schedule them into, a bed of somebody that's leaving. But to just take the chance of, okay, you need to find a place, and, the kids are scurrying around trying to find a good place, and they're running around like crazy, and it's stressful. It's just so much better if you do that prior to the surgery.
You've had a lot of begging. I can hear that.
Oh, yeah.
A lot of begging. How much will it take? How much can I pay you, right?
Oh, I've had that.
Have you really?
Yeah, I had some guy, it wasn't too long ago, he said, what will it take? Well, nothing. He wanted a private room. I didn't have one. It's like, there's nothing you can do to just get one, But, yeah, so it's certainly better if you plan in advance, just like anything.
Especially if you know it's going to happen. You may not always know, but all right. So now we've talked about, and I guess you encompass the physical, the occupational, which means to get you back if you have a job, different ways that you need to think about. Or you said, I know you have a kitchen now that people can figure out
how to cook.
Right. Well, how to cook it. If the coffee is, you have your glasses up on a shelf, a high shelf. How are you going to do that? Right.
And if it's been, I would say, a life-changing event, then you need to, you need to learn how are you going to rearrange your kitchen so that you can get to everything.
And will you help them?
Yeah. Occupational therapy does that. They deal with activities of daily living.
So they'll go home with you or with them to their home, and they will readjust things?
Mostly it'll be the home health occupational therapist that would look at that. We will work with them while they're in the facility to, you can't reach that top shelf anymore. So you're going to have to, put those things in different places. They have the reachers that you can get things with the reachers, which, I'll tell you a funny story. I'm always dumping things behind my desk. And I have a reacher in my office. So I'm reaching to try and get stuff that I dropped behind the desk. And I never realized that this particular reacher has a magnet at the end of it. So I pull it up and I've got the stuff that I lost.
Paper clips and everything, right?
Oh, yeah. It was loaded with it. It's like, wow, I didn't know that was there.
Right.
So there's different kinds of reachers apparently as well. So
Yeah, right. Well, that's very good because I do have things I know also behind things, and so a reacher is a good idea.
Yeah.
And now, do you have like a store? You don't have a store there for people that when they come out of the hospital, they go first to a home. I guess you call it what? It's a supply house where they have this.
They don't have to do that. I mean, when we order home health, we also order any durable medical equipment that they might need, which would be a walker, a cane, those things that a reacher.
Toilet seat? No, maybe not for
raised toilet seat or, shower chairs, 3-in-1 commodes. Yeah, that's all ordered for them before they leave.
I know you've been a nurse for a long time, and I'm wondering if this is something very new when what we're talking about. I mean, let's say 30 years ago, you're not that old, but let's say even if I were talking to someone 50 years ago, you've certainly known people in this business that long. What did they do? They didn't have all these extra little fancy things.
Some of it they had. I mean, 3-in-1 commodes have been around forever.
What's a 3-in-1 commode, please?
It can go over the toilet, and it can also go in the shower. So they call it a 3-in-1 commode. A lot of the stuff, has been around for a long time. It's certainly been perfected. It's much better than it was. There are different kinds of walkers. Back in the day, there was probably one kind of walker. Now there's all different kinds. There's 3-wheeled, 2-wheeled, 4-wheeled, rolling. I mean, it's just amazing.
I got my mother, when she needed a walker, I mean, I never took it myself, but she had a seat. So
right.
She could sit down while she was going.
Right, because if they get tired, they can rest. They didn't have that, years and years ago.
And then when you pick up the seat, there's some stuff in there you can keep.
Yeah, exactly.
My mother used to take home some of the food she didn't eat.
That's
I know.
Common.
Yeah, right. Well, it sounds like you have to have a lot of patience. You have a lot of love, but it's very, very hard for people who are sick and they don't understand. Some people maybe have a little bit of dementia, and it's not easy, but when you choose, or maybe when they choose to be a physical therapist or an occupational therapist or a social worker, they have to have a very strong feeling about people or they wouldn't do it.
I believe that. I really think that you have to love being in a business. And we were just talking the other day, there was a social worker that is an excellent social worker in the hospital, but apparently she worked at Regents Park for a short period, and she didn't like it. It's totally different.
How so?
Well, because they're going to stay with us a lot longer than they're going to be in the hospital. After the hospital, now you start dealing with all the emotions and the fears and all that stuff that, they don't have to deal with as much in the hospital because they're sending them to us, and then we deal with it. You have patients that have cancer, they're going for radiation. We're the ones that have to pretty much pick up those pieces and help them through it and get them home safely. So it's a whole different ballgame. Now, I love rehab. I wouldn't want to go back to working in the hospital. I love what we do, because you see people get better and go home. And if you can't get them better, then we help them, decide what would be the best route for them. They can go home with hospice. They can just have palliative care. They can have 24-hour care in the home if that's what they need. So those are the different issues that we deal with. And that's, again, usually patients that have had a major event.
Well, you like to solve problems. I think that's something. Yeah. So we have listeners now who are paying attention, and they're learning a lot from you because, you see, until it happens to you yourself or to a loved one, this is all a mystery. You know that. Right.
Well, when you look at a patient that starts losing weight, why are they losing weight? Are they not eating because they're depressed? Are they not eating because nothing tastes good to them? Maybe they've got a swallowing issue. There's so many different reasons that somebody could start to lose weight. And if they come in with wounds, they need more calories. So the wounds will heal. Well, if they have no appetite, then you have to look at all different ways of trying to deal with that.
I guess we also always thought a doctor would be there telling you, but I know that's not possible. A doctor, it's pretty acute. I mean, the doctor deals with something, but then he's not or she's not there anymore.
Right, and it's us calling the doctor to say, we need an appetite stimulant, or we need an order for psychiatry or psychology, or we need speech to, so it's kind of, we're there observing that patient 24/7. The doctor comes in and they're good, but they're not there for, hours with each patient. So it's us calling them to say, we have a problem, or we need a solution. And, then we can recommend whatever the discipline is, we'll make the recommendations as to what they feel that the patient would need. And, the therapists are experts. I mean, they know, about how long a patient needs to stay. We look at like a prior level of function. What were they doing before, they ended up in the hospital? Were they independent? And, it's very hard because you'll see somebody come in with a stroke or something like that. And, their loved one, they were driving right before this happened. Well, they were. They're not going to be driving now, but you have to feed them that information, slowly.
You mean they will never be able to drive, or they're not driving just while they're sick?
Depends on how severe it was. But usually, if you have some kind of a brain injury, whether it's a stroke or a traumatic brain injury, it's going to be a long time before you drive. And again, it depends on what deficits you still have. If you have motor deficits, excuse me, you don't want them behind the wheel.
No.
Or visual.
Absolutely. This is always so amazing to me that someone can come on the radio show and explain it. And that's really why we do this. I always felt that if you know a lot more, you will be able to be more understanding of your loved one's situation, because I think the family will lose patience with that person, thinking that they're just being a baby.
Oh, yeah. And you have to look at, like, again, I always go into how is it affecting their mood? Why are they not motivated? Some people just aren't motivated. Well, they're depressed. Excuse me, I've got a tickle in my throat. So you have to look at all the different resources that you have at hand and, make them available for every resident and patient that could use it. And a lot of them do. I mean, it might just be, a counselor to speak to for, a couple of weeks. It doesn't mean that they necessarily need medication. And some people do. It's just a real crisis that they've gone through. So they can certainly use, some medication short-term to help them get through the crisis.
And because everyone is an expert. I mean, you do have an extraordinary staff. And that's really important. Of course, we never talk much about your owners, but they've been doing this for a long time, and they have always expected the very best for the people that they take care of. So they do get the very best to do that.
Right, absolutely. And that's important too, the team. And we meet once a week for our short-term residents to discuss their progress, any barriers to the progress. Of course, we always want to think that everybody that comes in is going to go home. Sometimes that's just not feasible. They need too much care, and their progress is just not going to be where we'd like it to be. And again, that's a catastrophic kind of situation. And a lot of times people with mild dementia, when you put some depression into the mix that's not been treated, families get frustrated because they won't do what the family wants them to do. Because, there's other things going on besides just mild dementia. So it's important for us to look at every aspect of the patient and the family. The patient doesn't end at the bedside, at the foot of the bed. there's that family right there.
Oh, I like that. That's very true. That's right. You have to deal with the family or people who are friends. I'm sure I can just picture this because I go to things, and I was at the doctor's with my husband, the ophthalmologist, the other day, and I heard someone talking, and her two friends were with her, and said they were really giving her their opinions. Well, you should tell them this and don't do this. And right. I was listening, and I thought, well, if that's what you're talking about with people coming and helping, now you have to deal with those people too, don't you?
Well, you do. And, in everybody's life, we all have a pecking order. Whether it's a spouse, sisters, friends, they all have a place in your life. And when somebody is sick or has had an event in their life, that pecking order gets changed. And that's why I'm saying, the patient doesn't end at the foot of the bed.
You must have taken a lot of psychology in your classwork. And so, Leslie, you just always, every time you come here, I learn so much. I know that our listeners learn so much. It's Leslie Curtis, Director of Business Development at Regents Park of Boca Raton, and their phone number is 561-483-9282. Their website is regentsparkboca.com. You should really go by there. And I know Leslie's busy, but if you make an appointment, and she'll show you around so you understand more, especially if you're if you have something that you're expecting to do, if it isn't an emergency. Right?
Absolutely.
Pre-planning. So thank you, Leslie. I know you're busy, and I know you have to get back to your official position, but we always appreciate your coming here.
Thank you so much.